Thank you, Deputy Speaker. Well, we know that our health system is in crisis in Victoria. It's broken. We've heard so many examples, certainly from our side, about people waiting for an ambulance, people waiting for a bed, 100,000 people on a waiting list. It's absolutely beyond belief that we've got now 100,000 people that can't get a surgery here in Victoria. 000, a lucky dip whether somebody actually turns up, ambulance ramping. Code Brown, no other state seen a Code Brown except for Victoria, and the Victorian Minister for Health, which has brought this motion before the Parliament today, blames the federal government, and he says, well, it's a pandemic that it seems be hitting Victorians harder than every other state. Well, you know, our system is broken because this government has been in power 18 of 22 years, the Premier, either the Health Minister or the Premier for 11 of those 15 years, and this didn't happen overnight, Deputy Speaker. This happened over a long time of negligence. Now, this government is claiming that the federal government should provide more money. Well, this government, prior to the pandemic really hitting its straps, in just 2 years ago, just around April Fool's Day, said, well, we're going to provide $1.3 billion worth of money, 4,000 beds, additional staff, to prepare for the pandemic. $1.3 billion, 4,000 beds to prepare for the pandemic. Money and beds that never, ever happened. Well, was it an April Fool's Day joke? I don't know. Because only last week, we then get, or on the weekend, we get, again, the Health Minister roll out with the acting Premier to say, well, we're now promising $1.5 billion to fix the health system. Well, let's hope this time around they get it right, because we didn't see the 1.3, and if we had that money 2 years ago, we would not be in the mess that we are currently in right now. Now, let's just also focus on this motion, Deputy Speaker, because this motion blames the federal government. The Health Minister, who blames the federal government for the health crisis, came out on the weekend and said $1.5 billion to help fix the health system. Well, the Health Minister failed to mention where that money is actually coming from. Half of that money, 50% of that money, is coming from the federal government. So the federal government's kicking in 50% to fix what the state government has created in terms of this mess, and no acknowledgement. Only, instead of any acknowledgement or even a thank you, instead what we do is we get a motion today blaming somebody else. This government is very good to blame someone else but not take responsibility for their failure. And in the meantime, we've got people waiting for an ambulance, people dying calling 000. 12 people died. 12 people died waiting for 000. 100,000 people waiting to get a bed. Chronic issues that go beyond elective surgery. We've heard them. We talk about them each day in question time. And the minister says, well, I'm not sure about this one, I'm not sure about that one. These are real people suffering pain under this government. And let me tell you one other thing, Deputy Speaker. How would you trust this government with any money at all when they've blown $24 billion worth of money? It's like giving your child, a naughty child, a credit card that they keep spending and ramping up time after time to a point where it's cleaned out the bank account. Would you give them any more, or would you cut up the credit card? Well, I tell you what, this government is absolutely drunk on spending, and spending not where it counts, but blowing budgets. $24 billion of blowing budgets. $24 billion. $24 billion is the equivalent of about 48 hospitals, up to 48 hospitals. $24 billion. And the member for Bentley can laugh and carry on, but this is quite serious, member for Bentley. I tell you what, member for Bentley... Member for
Caulfield, I would ask you not to respond to interjections. Member for Bentley.
Deputy Speaker, in the seat of Bentley, I had a constituent contact me last week trying to get their child to hospital. They were waiting for an ambulance to turn up. They waited over an hour. They then waited for hours in the emergency for that child to be treated. So I'm sure, Deputy Speaker, in seats like Bentley, there is a health crisis that this government has failed to fix. And I know because constituents in Bentley are contacting me because they can't get any help from the member for Bentley. Now, let me continue about some of these issues. $24 billion of waste. Now, on the weekend is the Good Friday appeal. The Good Friday appeal, the Royal Children's Hospital, that costs $1 billion to build the whole thing. We could have 24 Royal Children's Hospitals for the money that's been wasted under this government. 24 of them. So when everybody gives as they should during the Royal Children's Hospital appeal, just think how much the Victorian Labor government have wasted through mismanagement of major projects. Let me give you some examples. North East Link, that has blown out to $10.79 billion. That's 10 Royal Children's Hospitals. Metro Tunnel, $3.4 billion. That's 3 Royal Children's Hospitals. Level crossing removals, $3.3 billion. Another 3 Royal Children's Hospitals. Westgate Tunnel, that's blown by $2.7 billion, almost 3 Royal Children's Hospitals. East West Link, $1.3 billion. Another 1.5 children's hospitals. Victorian Heart Hospital, $564 million. Well, that blowout promised $150 million, blown out. Well, you know, it just goes on, Deputy Speaker, in terms of this cost. This waste that this government has blown could build so many hospitals, could fix the health system. The $24 billion would repair our health system and get it back to where it once was. And yet the government is asking for more money. The government is saying, you know what, we've wasted ours, so how about you kick in more? Well, how about this government actually do their job and actually budget properly and not spend and waste taxpayers' money on projects that they obviously clearly cannot manage. They clearly cannot manage. And you know what? In my electorate of Caulfield, Alfred Health in Caulfield needs $500 million to build a whole new hospital. $500 million. You've got $24 billion worth there. I could build 48 or thereabouts, 48 Caulfield hospitals with the budget blowouts, 48 of them. Now, all we've got from the government at the moment is a feasibility study to look at what they're going to do with the Caulfield site. And we know, well, as the member for Sandringham said, sell it. Well, you know, that's possible as well under this government. They're broke. So who knows what this government's going to do in terms of selling hospitals. That's probably on the cards. But I'll tell you what, this government does not care about what they've done in the health crisis in this state. A health crisis that will go on for years in terms of what it's done for pain and suffering. A health crisis that is also a mental health crisis as well during lockdowns. And for the health minister to also say, when it comes to isolation and masks and other things, as he said the other day, what are you going to do about that? It's a federal government problem. It's a federal government problem. Is this government going to take any responsibility for anything? A government that is about to kick on the emergency management powers again. So we have isolation, mandates and masks again, kick down the can for an indefinite period of time. Victorians are sick of fear. They're sick of control. They're sick of a government that won't let people get on with their lives. Now, we've got a broken health system. We've got schools that are still suffering under this government and kids that have suffered from homeschooling and the mental health crisis because a government that's provided the longest and harshest lockdowns in the world. What a shocking record to have. What a shocking record to have, and the Minister for Environment says that's rubbish. Well, tell me another place in the world that had a longer lockdown than Victoria, Minister for Environment. Tell me one of them. I don't know any other of them. I don't know any other. Well, the Minister for Environment says, do your homework. Well, I'd welcome to know another place anywhere in the world that had longer lockdowns than Victoria. Another place in the world. You know, we just want to wipe off history. They want to wipe history in terms of what this government has done to Victorians, ordinary Victorians that have suffered, that have absolutely suffered under this government. They've suffered a health crisis, they've suffered a mental health crisis, and they've suffered by lockdowns from an incompetent Useless government.
Minister.